Hey, welcome. If you're here, chances are you or someone you love is navigating a pretty tough road. So we're here to take one big area of concern, your skin during radiation, and turn that anxiety into action. Think of this as your personal game plan.
Okay, let's just get right into it. One of the first things people ask when they start radiation therapy is, what's going to happen to my skin? And you know what? That's a totally fair question to have. The best part is there are real, concrete things you can do to manage it. So this explainer is all about giving you that clear, actionable plan.
So, first things first, let's talk about the why. Honestly, understanding why your skin is reacting is the most important first step. Once you get that, the how to care for it part makes so much more sense.
It's actually pretty straightforward when you think about it. Radiation therapy is incredibly powerful stuff, designed to zap cancer cells. But to get to the tumor, those high-energy beams have to travel through your skin. It's that journey, that passage of energy, that causes the side effects we're going to learn how to manage. Now, you're probably going to hear your doctors and nurses use a specific term, radiation dermatitis. It sounds kind of technical, but all it means is the skin changes caused by radiation. You know, the redness, the dryness, the irritation. Giving it a name helps, right? It means this isn't some weird, mysterious thing. It's a known, expected, and totally manageable side effect of treatment.
So, what's actually happening on a structural level? Well, the radiation makes your skin thinner and way more fragile. It loses some of that bounce back, that elasticity. It also means it's going to heal a bit more slowly than you're used to. And this last one, it's a biggie. The treated area will be more sensitive to sunlight for the rest of your life. That's not temporary. That's a new rule to live by.
Okay, so now that we know why it happens, let's talk about when. A huge part of getting rid of anxiety is knowing what's coming down the road. And the great news is, these skin reactions follow a super predictable pattern. We can literally map out the journey for you.
And here's what that map looks like. For the first week or two, you might not notice much, maybe a little pinkness or some itching. Then, as you get into the middle of treatment, it can start to look and feel more like a sunburn. By week 4 and beyond, that redness might get brighter, and you could see some peeling. Knowing this timeline helps you anticipate what's next, instead of just reacting. And look at that last point. Healing starts pretty quickly after your treatments are done. Now, there is one more serious reaction we need to keep an eye out for. It's called moist desquamation, fancy name, but it basically means the skin is weepy, blistered, or raw. You'll see it most often in skin folds, like under the arms or breasts. This is one of those times where you don't wait, you call your care team right away.
All right, we've talked about the why, and we've talked about the when. Now we get to the best part, what you can actually do about it. This section is your toolkit. This is your daily defense plan, and you can start using it today. This is where you take control.
Think of these 5 things as your golden rules. They are the foundation for everything. It's all about being gentle and protective. So cleanse with lukewarm water and pat your skin dry. Never rub. Moisturize like it's your job. Wear soft, loose clothes to cut down on friction. Steer clear of irritants like perfumes or harsh lotions. And finally, protect your skin from extreme temperatures, so no heating pads or ice packs on that area.
So, what kind of stuff should you actually be using? Let's break it down into 3 simple categories. First, you've got your everyday heroes, brands like CeraVe, Aquaphor, Cetaphil, great for basic, solid moisturizing. Then you have specialty products made just for radiated skin. And finally, there's the prescription stuff, like steroid creams that your doctor might give you if you need something with a little more kick to fight inflammation.
Okay, everybody, listen up, because this is probably the single most important timing tip you're going to get. Any cream, any lotion, any ointment you put on has to be applied at least 1 hour before your radiation session. Why? Because you need it to fully absorb. You don't want anything sitting on the surface of your skin that could interfere with the treatment. So please make this a non-negotiable rule. 1 hour before. Got it?
So what does this actually look like day to day? Let's build a routine. Step 1. In the morning, you'll gently cleanse, pat dry, and put on your moisturizer, remembering that 1 hour rule. Step 2. Choose your clothes wisely. Think loose and soft. Step 3. After your treatment, go ahead and reapply moisturizer if you feel dry. Step 4, in the evening, repeat the gentle wash and then really slather on that moisturizer. And step 5, and this is so important, inspect your skin every single day. Be your own detective so you can catch any little change right away. All right, let's head into our final section. This is all about staying safe right now and also looking ahead to the future.
It's about knowing when you need to pick up the phone and call your team, and understanding that this commitment to your skin is really a lifelong thing. These are the red flags. These are the do not wait, call your team immediately signs. If you see any sudden blistering or open skin, any signs of infection like pus or a bad smell, if you have pain you can't control, or a fever along with skin issues, you need to get in touch with your oncology team right away. Seriously, don't hesitate. And here's the thing. Once you ring that bell and your last treatment is done, your skincare journey isn't over. It just enters a new phase. That treated skin has been fundamentally changed, and it's always going to be more sensitive than the rest of your skin. It's a new reality, but a totally manageable one. So what does that lifelong care look like? It's really about simple, powerful habits. Keep moisturizing every day to support that skin barrier, and become absolutely religious about sun protection on that area. And I mean, for life. Keep being your own skin detective, watch for any long-term changes, and always report anything new or weird to your doctor. If you take only one thing away from our time together, please let it be this. Skincare is not an optional extra. It's not something you do on the side. It is a core part of your treatment plan, every bit as important as showing up for your radiation appointments. It's what keeps you comfortable and helps prevent delays in your therapy. So there you have it. We've walked through the why, the when, and the how. You now have the map for the journey ahead and a full toolkit to handle it. The only real question left is, what's your first step? How are you going to start building your skin defense plan right now, today? You can do this. You've totally got this.